I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
3 years ago, this past Saturday, on March 11th, the WHO made it clear. COVID-19 was a pandemic.
We're deeply concerned both by the alarming levels of spread and severity. COVID-19 can be characterized as a pandemic.
While the health emergency was formally declared by the WHO in January of 2020, for many governments, for many people, things didn't change until that fateful Wednesday in March. And that's when things kicked into high gear. It recommended countries require quarantining, masking, border testing, and that non-essential businesses close. But you remember that. And since the winter of 2020, a committee of experts has met every 3 months to talk about the global state of COVID. Now, even though rules have eased and people are going back to the office, public health restrictions have lifted.
In England, most COVID-19 restrictions have been lifted.
Masks on planes or trains, proof of vaccination, and the use of the ArriveCan app for travelers entering Canada all won't be mandatory anymore.
Globally, the health emergency hasn't been declared over. Despite all the waiting and wondering, what actually happens when it's finally declared over and done? So that committee that's been meeting periodically since 2020, the International Health Regulations Emergency Committee for COVID-19, that's who will make the recommendation about ending it. But ultimately, the call rests with the WHO. And the decision could have some broad implications for drug makers that have agreed to allow generic competition to their COVID treatments and to keep their vaccine prices low until the pandemic ends. The last time the committee met was at the end of January. And at that time, it said we were clearly in a far better situation now than we were a year ago.
The Omicron variant has been reported in 89 countries, with the number of cases doubling every 1.5 to 3 days.
Still, it said it wasn't ready to end the public emergency because there's still low vaccine uptake in low and middle income countries, even though more than 2/3 of the world's population have had at least one dose of a COVID vaccine. Last December, the Director General of the WHO said he's hopeful the world will transition out of the emergency phase of the pandemic this year. But a lot of countries have moved ahead on their own. In the US, President Joe Biden said that the COVID emergency declarations will end on May 11th. Here in Canada, we'll still be following the WHO recommendations.
In the upcoming year, we need to continue to monitor the evolution of the virus.
And when the pandemic is declared officially over, it obviously won't mean that COVID-19 vanishes into thin air. Vaccines will still be available, tracking may still happen, and meetings, including those at the WHO, will likely continue. It does mean the recommendations for how member countries handle the pandemic, the ones that brought most countries to a screeching halt 3 years ago, those recommendations could come to an end. But the overwhelming feeling seems to be that we've already put it behind us in many ways. So when the WHO does announce the emergency is over, it could be more about how we feel than how we act. I'm Lauren Bird. Thanks for watching. See you soon.